Most seniors have no idea what's about to hit their wallets in 2026. Medicare is quietly rolling out a series of changes, and while some might sound minor, together they could completely reshape how much you pay each month. We're talking higher premiums, new deductibles, and surprising rule adjustments that barely made the news. In other words, these are the kinds of updates that can slip right past you until it's too late. So in this video, we're breaking down the 5 biggest Medicare changes for 2026, what's going up, what's finally getting cheaper, and how you can prepare before open enrollment starts. Because understanding these changes early could be the difference between saving hundreds or losing them. Let's start with the first, and it's one that hits nearly every single person on Medicare. The first major change for 2026 is one that nearly every Medicare beneficiary will feel, and it's not good news. The standard Medicare Part B premium is projected to rise from about $185 per month in 2025 to $206 in 2026. That's an increase of more than 11%, one of the steepest hikes in recent memory. Now that might not sound like much at first glance, just over $20 a month, but multiply that across the year, and you're looking at nearly $250 extra disappearing from your Social Security check. And remember, that's not for additional coverage or better benefits. You'll be paying more for essentially the same plan you have right now. So what's behind the jump? Part of it comes down to healthcare inflation, which has outpaced general inflation for decades. Hospitals, prescription costs, and outpatient treatments continue to rise, and Medicare's spending formula automatically passes part of that cost on to beneficiaries. There's also a growing concern that the Medicare Trust Fund is running thin, meaning these increases may be part of a long-term effort to stabilize the program's finances. For seniors living on a fixed income, this is where the pressure starts to build. An extra $20 or $30 a month might not seem catastrophic, but when combined with higher food prices, property taxes, and utility bills, it starts to pinch. And because Medicare premiums are usually deducted directly from your Social Security payment, you might not even notice the increase until your deposit quietly shrinks in January. What makes this even trickier is the way Medicare calculates what you owe. Your Part B premium is based on your income from 2 years ago, not your current income. So if you've retired recently, downsized, or had your income drop substantially, you could still be charged a higher premium based on outdated numbers. The good news, you can file what's called a life-changing event appeal through the Social Security Administration. This allows you to request an adjustment if your income has gone down because of retirement, loss of a spouse, or reduced work hours. But few people even know this option exists. The takeaway is simple: unless you plan ahead, this premium increase could easily catch you off guard. It's one of the first warning signs that Medicare's costs are shifting more responsibility onto everyday Americans. And sadly, this is just the beginning, because right behind this premium spike comes another sneaky increase that will hit anyone who uses a doctor or outpatient service. As if higher premiums weren't enough, Medicare is also raising the Part B deductible for 2026. The amount you pay out of pocket each year before Medicare begins covering outpatient services like doctor visits, lab work, and tests. In 2025, that deductible was $257, but it's rising to $288 next year. It might not sound like much, but combined with the premium hike, it means an extra $300 to $400 a year for most retirees, even if your coverage stays exactly the same. This increase especially affects people with Medigap or supplement plans like Plan G, since they must pay the full Part B deductible before their coverage kicks in. For anyone managing multiple conditions or living on a fixed income, that bump can feel significant. Medicare adjusts deductibles based on overall healthcare spending and medical inflation. As outpatient costs climb, those expenses get passed down to beneficiaries. The problem is that for many seniors, these small increases add up quickly and can lead to delayed care when money is tight. The best thing you can do is review your plan early and budget for the higher deductible now. Preparing ahead of time helps prevent those unpleasant surprises once January rolls around. And if you thought that was bad, wait until you see what's happening with prescription drug coverage. The one area most people assumed was finally under control. The third big change for 2026 hits prescription drug coverage, and this one's a mixed bag. For years, lawmakers have promised lower drug costs under Medicare, but the numbers for next year tell a more complicated story. The out-of-pocket cap under Part D, which limits how much you pay before catastrophic coverage kicks in, will rise from $2,000. It's only $100, but for anyone managing expensive medications, that extra cost lands right where it hurts. On top of that, the Part D deductible, what you must pay before your plan starts covering prescriptions, will increase from $590 to $615. That's another quiet adjustment that many people won't notice until they're at the pharmacy counter. And for those on fixed incomes, these back-to-back cost increases start to chip away at the savings promised just a year ago under the Inflation Reduction Act. So what's really going on? Experts say that drug manufacturers and plan providers are still negotiating pricing models, and the government's cost-sharing formulas are adjusting to reflect higher spending projections. In simpler terms, the system's catching up to inflation, and beneficiaries are footing the bill. If you take multiple prescriptions, this is the year to review your plan options early. Compare formularies, look at preferred pharmacy networks, and make sure your medications are still covered at the lowest rate. Sometimes just switching plans during open enrollment can save hundreds of dollars. Now, not all the news is bad. Among these cost hikes, there's finally one change that offers real relief, especially for the millions of Americans who rely on insulin to survive. Finally, some genuinely good news. After years of frustration over unpredictable insulin prices, Medicare is officially capping the cost of insulin at $35 per month starting in 2020. That means no matter which Medicare plan you're on, Part D, Medicare Advantage, or a supplemental policy, you won't pay more than $35 for a month's supply of insulin. For millions of Americans managing diabetes, this is a huge relief and a long overdue win. But the good news doesn't stop there. Medicare is also expanding access to zero copay vaccines, covering shots that the CDC and Medicare Advisory Board deem essential, like shingles, flu, pneumonia, and COVID-19 boosters. For many seniors, this could save anywhere from $50 to $300 a year, depending on how often they get vaccinated. These updates are part of a broader push to make preventive care more affordable, helping seniors avoid the serious complications that drive up long-term health care costs. It's one of the few bright spots in an otherwise expensive year for Medicare. Still, experts warn that while the insulin and vaccine relief is a welcome improvement, it's also relatively narrow. The price cap doesn't apply to every medication, and it won't offset the rising costs in other areas of coverage. So while this change finally gives seniors a bit of breathing room, it doesn't erase the fact that overall Medicare costs are still trending upward. And that brings us to our final and perhaps most controversial change for 2020, a quiet adjustment that could raise premiums for thousands of retirees without them even realizing why. The fifth major change for 2026 is one that catches a lot of retirees by surprise: the IRMAA adjustment, also known as the income-related monthly adjustment amount. This is the extra charge added to your Medicare Part B and Part D premiums if your income is above certain thresholds. And those thresholds are tightening next year, meaning more people could be pulled into higher payment brackets even if they didn't technically get a raise. Here's how it works. IRMAA looks at your modified adjusted gross income from 2 years ago, not your current income. So for your 2026 Medicare bill, Social Security will use your 2024 tax return. That's where many retirees get blindsided. Someone who earned more before retiring, sold property, or withdrew from an IRA 2 years ago might now have a much lower income, but they'll still be charged as if they're in that higher bracket. For 2026, early estimates suggest the first IRMAA tier could start around $103,000 for individuals and $206,000 for couples, though final numbers haven't been released yet. Crossing that line by even $1 could add hundreds of dollars a year to your Medicare costs. And these surcharges don't just affect wealthy retirees. Middle-class seniors who sold a home, converted retirement accounts, or took one-time income in 2024 could see themselves hit with an unexpected premium hike. The good news is that you can appeal your IRMAA if your income has dropped due to a life-changing event such as retirement, loss of a spouse, or reduced work hours. You'll need to file Form SSA 44 with the Social Security Administration, explain the change, and provide documentation. Many seniors never realize they can do this, but it can save hundreds, even thousands, each year if approved. The bottom line, IRMAA is expanding, and more retirees will be affected in 2026 than ever before. It's one of those changes that quietly eats away at your Social Security check, and unless you act early, you could end up paying far more than you should. Now that we've covered the 5 biggest Medicare changes coming in 2026, from premiums to deductibles, prescriptions, and income adjustments, let's wrap up with what this all means and what you can do right now to stay ahead. So here's the bottom line. Medicare in 2026 will look very different. Premiums are climbing, deductibles are higher, prescription costs are creeping back up, and more retirees will be hit with income-based surcharges. Yes, there are a few bright spots like the insulin cap and free vaccines, but overall the trend is clear. Seniors are expected to shoulder more of the cost. That's why planning ahead is critical. Start by reviewing your coverage now. Look at how much you'll be paying in premiums. Check if your prescriptions are still covered under your current plan, and talk to a licensed Medicare advisor before open enrollment. If your income has changed since 2024, don't forget to file that IRMAA appeal. It's one of the few tools you have to lower your monthly bill. Most importantly, don't wait until January to react. The earlier you understand these changes, the more options you'll have to protect yourself and your budget. If you found this breakdown helpful, make sure to like this video so it reaches more seniors who need to hear it. And don't forget to subscribe, because this is just part 1. In our next video, we'll cover what's happening behind the scenes in Washington, the discussions about the future of Medicare that could impact coverage for years to come. Thanks for watching, and remember, understanding your Medicare options isn't just about saving money. It's about making sure your health care and your future stay secure no matter what changes come next.